Firstly, on the Prime Minister, if the Prime Minister is ill enough to need to be in hospital, how can he be well enough to run the country at a time of national emergency? Wouldn't it be better if he stepped back even briefly in order to recover properly? And if I could ask the medics, you say that the restrictions are working, but too early to tell the long-term effects. But what would your view on what a likely exit strategy from the restrictions be?
Thanks, Laura. Well, first of all, on the PM, he was admitted to hospital for tests as a precaution only. And that was because some of the symptoms that he had when he first tested positive had persisted. He's had a comfortable night in St Thomas's, he's in good spirits, and he's being regularly updated, and he still remains in charge of the government, and we're getting on with all of the various strands of work to make sure at home and abroad we can defeat the virus and pull the country through coronavirus and the challenges that undoubtedly we're facing at the moment. Angela, do you want to comment on the technical?
Our advice has been very straightforward, that we need a good long time series of data on all of these stages of infection in order to be able to tell what the impact of the measures that came in on the 23rd of March are going to be. It's too early to tell yet. We need people to carry on following those instructions so that we can work out 3 weeks later what actually happens in hospitals.
Or does that give you the answers you need? Do you want to come back?
I just wonder, there is increasing discussion about what the exit strategy from these restrictions should be. I would be interested to hear Angela or Professor Whitty's view on what they might anticipate, given all the uncertainties around.
Again, our suggestion has been completely clear. We need to know how well the current restrictions are working before we can say anything sensible about what the next stage might be.
The number one priority, Laura, right now is to stop the spread and to make sure that we can get past the peak. And I think that's the overriding focus of the government right now. And the other decisions can be considered in light of the evidence that we're taking from Angela and Chris in due course. Beth Rigby from Sky.
Thank you. Foreign Secretary, one of your team, Africa Minister James Duddridge, today urged the Prime Minister to rest up and let others do the heavy lifting until he gets better. Do you not agree that the Prime Minister at this moment needs to rest, not work? And a question to Professor Whitty. First up, welcome back. It's nice to see you back. We're entering the third week of lockdown. The government said it would review the lockdown at the end of this week. Given we're now approaching the peak of the epidemic, will you be advising ministers to keep these measures in place? And can you give the British people a sense of whether this will continue for weeks or months? Thank you.
Well, on your question about the PM, look, he's in charge, but you're right, he'll continue to take doctors' advice on what to do next. And we have a team which, in the way I described, is full throttle, making sure that his directions and his instructions are being implemented and followed through, whether it's the purchase of ventilators through to the diplomatic effort to return UK nationals who are stranded abroad. But as ever, the Prime Minister will take the medical advice that he gets from his doctor. Chris.
And just to add, and I'm basically going to say exactly the same thing that Angela said earlier, which is the key thing is to get to the point where we are confident we have reached the peak and this is now beyond the peak. And at that point, I think it is possible to have a serious discussion about all the things we need to do step by step to move to the next phase of managing this. But I think to start having that discussion until we're confident that that's where we've got to would, I think, be a mistake.
Robert Peston, ITV. Oh, sorry, Beth, did you want to come back?
Yeah, just to follow up, Professor Whitty, though, just to be clear, given that we are approaching the peak and it's the end of the week, whereby the government will review whether to relax restrictions, it seems to me you are saying that the lockdown measures will continue beyond this end of this week.
Well, I think to be clear, we do not think we know for certain that the peak will be at the end of this week. This was the point that Angela was making earlier. And I think until we're confident we're there, that would be too early to start calling the point where we can move to the next phase of this epidemic.
The government's number one priority, its overriding priority, is to get past the peak. And we do that by stopping the spread, which is why those decisions and those considerations, Beth, you rightly referred to, will have to wait until we're beyond that point. Robert Preston, ITV.
Good afternoon. Couple of questions, probably for the two scientific experts. First, for Professor Whitty, I think none of us can really know quite how much burden it is, even when one's in the peak of health, to be Prime Minister. The normal advice when somebody's been as ill as the current Prime Minister is to rest in order to get better. I mean, he's not superhuman. Some would argue that he is taking too much of a risk in the extent to the extent to which he's still working. So as a doctor, Professor Whitty, I just wondered if you could comment a bit on that. Secondly, I completely understand why you are saying we cannot outline a plan for lifting the restrictions until we know whether the current measures are working. But equally, the damage from a prolonged economic lockdown will be tremendous, in the sense that, you know, as an economy, we simply won't be able to generate the revenues that pay taxes, that fund public services, and the rest. So I do think the British people would want to feel that the government is working on a workable strategy. And in particular, is it possible to exit the lockdown unless and until we have a program of mass testing for the virus, and unless and until we have technological solutions for tracing people who may have come into contact with those who have the virus?
Well, I'll let Chris comment on the technical aspects, but first of all, just to be clear, the Prime Minister, both in terms of going into St Thomas's yesterday, was taking the advice of doctors, so he's followed the doctor's advice there, and in terms of his recovery in the days ahead, will continue to do so. And just again on the exit strategy, let's be clear about this. I mean, I'll let Chris talk to the technical points, but the risk right now is if we take our focus off the strategy, which is beginning to work, is that we won't get through the peak as fast as we need to, which is why it's perfectly legitimate to ask the question. But the government's overriding priority has got to be to keep up the work and the commitment that so many people have made to make sure that we maintain the social distancing, we stop the spread, we protect the NHS as we come through the peak. Chris.
So my advice to the Prime Minister was to take the medical advice of the excellent NHS doctors who are advising him, and I'm sure he'll continue to do that. The only bit of advice I gave in addition to that was, as was widely reported, I did advise him to get tested in the first place because I thought that was prudent. But after that, I didn't wish to muddle my role with him. I'm not his medical practitioner. I'm his advisor on wider issues. In terms of the point you make about, there must be planning for next phase. Of course there is, and it's quite complicated. There are a very large number of technical elements which need to be brought together. Testing is one of them, but it also involves, for example, considering the likelihood of a variety of different other technologies, including vaccines, including drugs, and when they're likely to be available. I think the one thing I would say at this point is we've got to remember, just from the health point of view, and clearly there are wider social and economic issues as well, that there are at least 4 different kinds of mortality and ill health we need to take into account over the period of this epidemic. There's the direct effects of people dying from coronavirus. There's the indirect effects of the NHS if it were to become overwhelmed and therefore unable to provide emergency care for either coronavirus or other areas. And all the activities we're doing at the moment are to make sure that both of those are minimised. But it is really important also to remember that there will be effects from the fact that some healthcare has had to be postponed to make room for this within the NHS. And of course, anything that has an impact on the socioeconomic status, particularly of people who are more deprived, will have a long-term health impact as well. And we have to, in our exit strategy, balance all of these different elements, which to some extent can be in tension. So I think it's just important to understand this is going to be quite a complicated set of trying to work out how different things fit together as we move to the next phase of this epidemic.
Does that address your questions, Rob?
Well, except I'm just being thick, I suppose, but I don't really understand why talking about, even if it's in the long term, the way we're going to exit, it somehow distracts from the imperative of social distancing. I think everybody accepts social distancing is absolutely vital, but why giving people hope that there is a plan to exit? Why does that, in a sense, reduce the urgency for people of doing what they're doing now?
Well, I think the two reassurances I can give you are that work, so that we can properly assess the measures that have been introduced, is in place, but also that we do not want to confuse the message right now, because we are not past the peak. To get past the peak, we must have people respecting those guidelines. Otherwise, we undo all the good work that so many people have achieved and contributed to through their forbearance, particularly as the weather gets a bit warmer.
And we can only make calculations about what we might do next if we have some reasonable data on how large the impact of what we've done is so far, and we can really only start to collect that from now, because we're now about 2 weeks after people would have got infected on the 23rd of March or later.
Thanks, Angela. Victoria MacDonald, Channel 4.
Thank you very much. I was wondering, how does the number of patients in ITU beds in London right now compare with what you'd been planning at this stage? And is there any suggestion that maybe you won't need as many beds as at the Excel Centre at the Nightingale as you had expected?
Well, I don't know whether Angela or Chris, you want to
that. I mean, there's a very long answer and a very short answer. The very short answer is our principal aim in both the fantastic response from the general public in terms of social distancing and all the things people have done and not done on that, and also of the NHS staff who've built things up, is to ensure that the gap between the number of beds available for intensive care and those that are needed is always in a situation we have some room to spare.